Welcome to the video supplemented instruction of the clinical skill epidural placement. My name is Doug Hardikoff and I'm a senior SRNA at Baylor College of Medicine. First, please take a moment to pause the video and read through the objectives. To begin, gather your supplies. This includes an epidural kit, sterile gloves, a large tegaderm, and a patient cap. You also need pump solution, tape, mastosol, and chlorhexidine swabs if desired. Open your epidural tray. Once open, drop in your sterile tegaderm and any other sterile supplies that you may want. With clean gloves, position the patient towards the edge of the bed with their head and shoulders slouched forward. Find the top of the iliac crest bilaterally. Find the medial point in the back at the same level. The line connecting each crest is known as Tuffier's line, which corresponds with the L4 vertebrae. You may have to adjust your thumb slightly to find the vertebrae. Just above is your target, the L3 to L4 intervertebral space. Make a mark with your nail here so you can identify the space later. Clean the patient's back with betadine or chlorhexidine, starting in the middle and working your way outward. If chlorhexidine was used, allow it to dry completely. If betadine was used, you can pat dry the excess betadine. While the prep dries, you can set up your epidural supplies in the order you will use them, including subcutaneous 1% lidocaine, a Touhy needle, a saline or air-filled loss of resistance syringe, the epidural catheter, the catheter hub, and the lidocaine with epinephrine test dose. With the prep now dry, place the sterile drape on the patient's back, taking care not to contaminate your gloves. Now, find your L3 to L4 intervertebral space again. Then, create a skin wheel of 1% lidocaine where you plan to place the Touhy needle. Now advance the needle like a finder needle into the interspace, aspirating the entire time. If no blood was aspirated, inject the remaining lidocaine as you withdraw the needle. Insert the Touhy where you injected the lidocaine, advancing along the same tract you made with the lidocaine. Once the Touhy needle meets firm resistance, you're engaged at the ligamentum flavum. Stop here. Withdraw the stylet from the needle. Attach the loss of resistance syringe with 3 to 5 cc of sterile saline or air per your preference. When you apply pressure to the plunger, resistance to injection should be met. Slowly advance the Touhy needle while intermittently or continuously applying pressure to the plunger. You will feel a sudden loss of resistance and the air or saline will be injected once you enter the epidural space. Stop here and remove the syringe while stabilizing the Touhy. Make note of how many centimeters deep the Touhy is at the skin. Begin to advance the epidural catheter through the Touhy needle. Your supervising CRNA or anesthesiologist can guide you in how deep they would like to initially advance the catheter. The catheter should advance easily. Unfortunately, because of the material of the mannequin, the very flexible epidural catheter was unable to be advanced far here. Once at an adequate depth, and while maintaining forward pressure on the catheter, withdraw the Touhy needle completely. As you withdraw the needle, hold the catheter slack in your hand as shown here to prevent it from falling off the sterile field and becoming contaminated. Now apply your sterile catheter hub. Recall the Touhy's depth at the skin. Add 4 to 5 centimeters to this and withdraw the catheter until you reach that depth. For example, if the Touhy is 5 centimeters deep when you lost resistance, you want the catheter to be 9 to 10 centimeters deep at the skin. To measure, use the circumferential markings on the catheter. 4 clustered bands represents 20 centimeters, 3 is 15 centimeters, and 2 is 10 centimeters. The long black line represents 11 centimeters at one end and 12 centimeters at the distal end. The remaining individual markings represent 1 centimeter between each of these aforementioned depths. If satisfied with your depth, you can remove the sterile drape, passing the catheter through the fenestration. Apply a sterile dressing over the epidural insertion site and prepare the patient for their test dose. Thank you for watching, and good luck with your epidurals.